Good afternoon. My name is Rhonda Von Shea Sharp, and I am the president and founder of the Women's Institute for Science, Equity, and Race. Welcome to our webinar, Childcare for All, Eliminating Childcare Deserts. This webinar will be moderated by Jerry Pender, Research Director at the Women's Institute for Science, Equity, and Race. Jerry is a logistics expert who analyzes data to improve processes for programs that impact disenfranchised communities. He is the co-owner of a child care facility and a Navy veteran. Jerry will be joined by Dr. Dionne Dobbins, who is the Senior Director of Research at Child Care Aware of America. In a recent NPR interview with respect to parents leaving the workforce, she said, "The impact on the entire country in terms of our economics is $57 billion in losses." I'd add that the economic loss is exacerbated in childcare deserts. We are excited to have the perspective of a childcare owner on the panel. LaKesha Petty is owner of Pamper Me Nursey, located in the Eastlake community of Birmingham, Alabama. She uses her training in early childhood education from the University of Alabama at Birmingham to nurture and develop the minds of infants to 4-year-olds. The webinar will be a conversation between Jerry, Dionne, and LaKesha with questions from the audience at the end. Please use the Q&A feature to ask your questions. Again, welcome, and I now turn it over to Jerry. Jerry, you're muted.
Welcome. There's an enormous amount of discussion taking place around the country on the state of childcare. As a supply chain professional, how I view the childcare system is as a network diagram filled with inputs of various types that make the entire system really quite complicated. If we take a look at this slide on our childcare network diagram, we can see all of the different inputs that are involved from the training pool to the training programs, labor force, service providers, and the customers. Everyone in this training pool has the option of either A, becoming self-employed and starting the home-based center, or B, moving into the educational field at various colleges or universities that offer everything from associates to bachelor's and master's degrees to early childhood education certificates. Obviously, these individuals who complete this program then move on into directors or teaching positions, depending on the degree type they receive. The next level is the service providers. As you can see here, there are 6 different types of service providers in America's childcare system: home-based centers, for-profit, nonprofit, government agencies, corporate facilities, and public schools. All of these facilities work together to provide services to an enormous variety of customers that are seeking childcare in America's system. According to the Center for American Progress, a childcare desert is defined as a zip code with at least 50 children under the age of 5, and either no childcare centers or so few centers that there are more than 3 times as many children under 5 as there are spaces in centers. If we look at this slide, we can get an accurate view of just how this equation works. This slide is an image pulled from the childcaredesert.org, which is a website operated by the Center for American Progress. This interactive site allows you to enter your zip code and find out if you live in a childcare desert. What we see here on the screen is an image pulled from this site of LaKesha's Child Care Center in Birmingham, Alabama, and all of the child care providers that are surrounding her. LaKesha, 11 years ago, you started your child care center as a home-based business. This graphic shows that where you're living, there's many child care centers around here. When you decided to expand into a fully licensed child development center, what were some of the issues you faced in moving from a home-based center to an actual CDC?
Good afternoon, and thank you so much for allowing me to join the panel today, Jerry. So to answer your question, some of the challenges that I faced when moving from a home child care center to actually, a licensed center from a home daycare was determining the location. And after a little bit of research, as you mentioned, there are several child care centers in my area. However, one of them actually serves infants. We are one of the centers in the area, if not the only center that actually offers care to children and families here in the area as early as 8 weeks old. And so the challenges that we face with that, of course, and what I found out was that the other centers had opted out of caring for infants because there are just a little bit more requirements when it comes to safety and making sure that we can safely get infants out in case of an emergency. So that was one of the challenges. However, that's something caring for infants has always been a passion of mine. So I definitely wanted to make sure as I opened the location that we were able to meet that need in the community.
Great. And that makes a lot of sense. And that's something that we can't see from the slide here that you mentioned, that your center is only the only one center that offers care for infants in the area. Even though we see that there are many centers in the area, it doesn't depict exactly what age groups are offered by each center. Right. If we take a look at our next slide, we can see the poverty area, the poverty levels in this area, and discuss how that might affect the placement of child care centers. So this graphic shows that where Pamper Me Nursery is located is also a high poverty area. Researchers from the center, researchers at the Center of American Progress have found that around 60% of the areas in the United States are classified as high poverty and urban. And these are also likely to be areas of childcare deserts. Dionne, in your years of conducting research on childcare, have you discovered any specific factors that might explain why in some instances low-income areas result in childcare deserts, but not in others?
Yeah, thanks for that question. I think what we really need to consider and think about that it's important to understand, or measure where there's less supply than demand for childcare center and really understand where those gaps are. But in my opinion, that's the first step of really thinking about what needs to happen and why these gaps may exist. So for instance, I think I've always said, you see one child care community, you've seen one child care community. You've seen one low-income community, you've seen one low-income community. It really, there are so many other factors to consider outside of income and poverty when you're thinking about why there could be gaps in child care supply. It's really critical to do what I call deep dives when you're trying to understand areas of the country or the community that are labeled as deserts. And in fact, at Child Care Way of America, we haven't been using the term deserts as much, but really trying to understand the gaps between supply and demand, and then working really closely with states or communities to understand why those gaps exist and what might work well in those communities to get rid of those gaps. So one of the first things that we talk about is doing a needs assessment or a supply and demand analysis, so that you understand what parents actually need in the communities that you're looking at where you see the desert. So for example, LaKesha mentioned that there were no infant toddler programs in her community, but yet if you looked at this, it didn't say that it was a desert. Well, is it more important to know that it's a desert, or more important to know that if you have an infant or a toddler, there may not be a place for you to send your child? And so that's why it's important to understand what parents need. And we know throughout the literature and throughout the work that we've done that there are certain communities that are having trouble accessing childcare. Parents of infants and toddlers are one of them. Other ones are parents that work non-standard hours. So you may not work 9 to 5 or 8 to 6. You may not be able to get to your child's childcare center by 6 o'clock. You might need the center to be open till 7 or 8. You might need to be there to drop your child off at 5 or 6, depending upon what your job is. You may need work. You may need someone to take care of your child during weekends, during holidays. So we know that there's not enough centers or family childcare programs that are licensed that can take care of families like this. And it's critical to know, what kind of offerings are happening in the communities that you're looking at. Other things to think about, do parents prefer home-based childcare or center-based childcare? There could be a variety of reasons why you might choose one over the other, particularly if you think about what has happened during the pandemic. We found that many programs or many families were preferring to send their children to family childcare, only because there was smaller settings. Many of those family childcare programs were able to be flexible and serve multiple age groups, whereas center-based may not have been able to do that on the turn of a dime. Other considerations: do you want your childcare to be closer to your work or closer to your home? So when you look at that childcare desert map, it's really looking at where you live. You're probably looking at where you live and figuring out what's in your community. But what if you want to figure out where there are centers or home-based care near your work? So really considering what is actually needed in the community. Another thing that we've been talking about is before and after care for school-age children. Especially during the pandemic, people were used to sending their children to school during the school hours and having the opportunity to send their children to before care or after care. When the pandemic hit and the schools closed, not only did parents need care during the day, especially if they were working from home and couldn't care for a child or couldn't make sure that the children, logged into Zoom or got into the right classroom. They needed people to help them with that. And they may have needed to work outside of the home. Some people didn't get to work from home, right? We've got our essential workers, our nurses, our people who, make sure, our doctors and nurses, people who make sure cities run and communities run, don't have the opportunity, didn't have the blessing of staying home like many of us did. So, but their children needed to go somewhere. So really, how do we make sure that we take care of those children? So it's really important to not just look at where those deserts are, but understand why people may have difficulty accessing childcare in those communities. So not only thinking about what the parents need, but also considering what are the important characteristics that parents are looking for. Are they interested in affordability? Of course we all are, but is quality more important to them than affordability? Are you willing to pay a little bit more to have a high quality program? Whose definition of quality are we talking about? Are we interested in, understanding where, well, as I mentioned, are we interested in childcare that's near the school, right, near the program, near the home, that kind of thing?
Yeah, and I think you bring up some very interesting points, especially with the non-standard hours. I think in most areas, there are a lot of childcare facilities that just run standard hours as, the public school system runs, and there are not a lot of people addressing the after-hour care. LaKesha, what has your experience been with families or parents seeking care after hours?
So what I've noticed with parents seeking care for, and typically they are like Dr. Dobbins mentioned, typically parents are looking for the before school or after school care hours. And so what I've seen is the need for our particular area too, is that parents actually need the service of transportation, meaning that they, have, contacted us and wanted to know if we were able to actually pick up the child, to bring them to our facility, either at the home or again, during that after school care, if we provided any services to pick up after school ended, so that to provide after school care for those school age children. So that's typically been our experience, and we're hoping as we continue to grow to be able to meet some of those needs. But of course, that requires what many employers are looking for right now, and that's dependable employees. And then one of the other issues that we face is really being able to pay a decent, and livable salary for those employees. So all of those are challenges that we are continuing to work through to find solutions for, to be able to meet that need in our community.
Right, right, and you're right. They're so important. And I know right now in Birmingham, Amazon decided to put a big headquarters building relatively close to your location there. Are you expecting kind of any uptick maybe in clientele and maybe even any further discussion? Because we know Amazon is a 24-hour operation that employs, thousands of workers in these big distribution centers. So I would expect that to be a big necessity coming to that area as far as the after-hour care and some of the transportation needs that you addressed. Dr. Dobbins, as you've taken a look at the funding that the government has kind of offered to address these issues, have you seen anything that you feel will help eliminate these childcare deserts or some of the factors that you just spoke about?
So I'd like to, at Child Care Away of America, we talk about committing to a better system long term. So we need a system that's, more accessible, equitable, and affordable to all families. And we need federal funding on a permanent basis. So we're excited. Don't get me wrong. We're very excited about the American Rescue Package and a lot of the other funding sources that are coming out and the proposals that are being touted by the administration and some key congressmen and women. However, we know that we're not going to make a dent in long-term issues like deserts without long-term robust investments. That said, we are excited about what the American Rescue Package is able to do. We have an entire part of our website that is dedicated to the American Rescue Package, and it includes a lot of great information. Let me see if I can pull up a slide that has some of those resources.
All right, that would be great.
Okay.
And in the meantime, go ahead, Dr. Dobbins, you have the slide for us.
Yes. Can you see this?
Yes, we can see it.
So, there's it's on our website. It's a resource hub. There's lots of information. I love this infogram that really shows how the money is being split up between the funding that's going through the Child Care Development Block Grant, and that is the $15 billion that can be used for state level experiences and state level work around building the supply of childcare. be used for a lot of different things. And then there's 24 billion, which is the majority of the money that goes to the child care stabilization plans and grants. It's really a great infographic because it tells you kind of the timeline, when the dollars will be available, when they need to be spent, how states are, when they're responsible for doling out those dollars. So there's a lot of background information, including the timelines and the allowable uses of those funds, many of which are great for dealing with issues that are related to childcare deserts. So paying for the losses that occurred during the pandemic, or thinking about how you can, paying for stabilization going forward, paying for doing things around worker compensation, and including more dollars for worker compensation, scholarships for providers, technical assistance around business, making sure that you think of your program as a business and helping providers understand how to spend dollars, how to ensure that they're fully enrolled, and recruitment and retention and that kind of thing. We also have a lot of policy recommendations where we talk about, yes, it's great that we've got this, the American Rescue Plan. It's great the American Families Plan and the American Working Plan are on the table, but we need to think about these long-term financing strategies for childcare. And there's some ideas around how you can support childcare in the long term and what we need to think about. We did a really interesting study in Massachusetts and in Southern California where we looked at, during the pandemic, how some states looked at paying for childcare providers using using enrollment instead of attendance. So instead of the number, calculating what they pay providers based on who shows up, they're calculating what they pay providers based on what their enrollment was. That was great, especially during the pandemic when their programs weren't seeing as many children come in. They were losing staff, but the light bills still had to be paid. You had to do all these things to keep your program running, in the hopes that when things came back, you would be able to continue to serve those families. So in Massachusetts and in Southern California, they were able to really keep those programs afloat, even when children weren't attending. Then we also have lots of information about the plan itself, what advocates can do, and how you can push back to legislators or to folks who are not really, who have some concerns about the way these dollars are being spent. So I just wanted to share that. That's all on our website. And I believe at the end of this presentation, Jerry will be able to show some of the other resources we have available on our website as well.
Great. Yeah, absolutely, we will, Dionne. Keisha, stand on the line of the type of funding that's available to child care centers. What percentage of your clients receive child care subsidies?
Yes, so that is a great question. Taking a look at our numbers right now, about 50% of the families that we serve participate in some kind of subsidy. What we are seeing, especially right now, as Dr. Dobbins mentioned, similar to Massachusetts and California, the state of Alabama has made some changes to the requirement to allow more families to be able to participate in those subsidies. So from my understanding, an adjustment was made to lower the income eligibility requirements that allowed more families to come aboard to assist with childcare. So we have received quite a bit post-pandemic of children who are now families are participating in one subsidy or the other that the state of Alabama offers.
Great. And would you say currently the funding that you're receiving or that your clients are receiving, is it geared more toward helping families pay for childcare, or for you to provide those services? Meaning, if you're dealing with income situations like the pandemic, So yeah, just if you know, some of the programs are more for families or more for the providers, if you can give us kind of a little information on that.
Sure. Well, absolutely. I think that it helps both the providers as well as the families. We have spaces, you know, and enrollment that we would like to see filled, you know. So in terms, it helps us both. You know, and centers have the option of whether or not they want to, you know, even enroll families who participate in some type of subsidy. So we're not, you know, particularly mandated, but of course, to better serve the community and better, you know, provide high quality childcare for families, we, you know, we've always been open to accepting some type of subsidies. So to answer your question, yes, I definitely think it serves its purpose. It's helping the providers as well as the families. As well. And again, it's based on the family's income, you know, and what they report. Here in Alabama, we have child care resources. That's one form of subsidy for our families. And then the other subsidy program is provided through a program called Child Care Central, which is directly connected to our Department of Human Resources. And so both of those funding programs have different qualifications that families are asked to meet. And from there, the subsidy pays a portion of childcare. And so that may look a little different from family to family. I've seen some parents who may have a copay, which means that that subsidy has given them you know, the responsibility of not paying their full tuition for them. So it puts a little bit of responsibility back on the parent. And then on the other end, you may have a family where, for instance, like for our first responders right now, Child Care Central is actually paying child care for those that they consider still our first responders at 100%. So, and again, that's something that's newly implemented as well. And to my understanding, that's not really based on income. Again, it's, you know, as a result of the pandemic and wanting to allow those families to have access to quality child care, they are, you know, if you can prove that, you know, you are a nurse or you are a police officer, then they are going to, you know, provide care for those folks right now at 100%.
Great, great. And so given that 50% or more of your clientele are on some form of subsidies, if these subsidies were taken away or reduced in any type of way, what type of an effect would this have on your facility and you continuing to provide childcare services in the low income area that you're located in?
Well, it would have an impact. Again, I think it would not only just affect us as a center, but it would impact those families as well, especially right now because we really, there's just such a high need right now for families who are, you know, and who need high quality childcare. Some of our parents, you know, maybe dad has returned back to work, but mom, you know, is still seeking, you know, employment opportunities. So, you know, the assistance from those subsidies help both us as the provider and the families as well. So it would have a huge impact on both us and the families again should those subsidies or federal funding go away.
Right. Yeah, that makes a lot of sense. If you're depending on those families to be able to pay for your services by using subsidies, if those subsidies are taken away, obviously, then that wipes out your
Absolutely.
clientele.
Absolutely.
So the next question is for both of you. We'll start with Dionne. So we've been discussing a lot about the American Rescue Plan Act, and the push for investing, even more funding into the childcare industry. Um, so what specifically are some provisions that you would like to see in addition to what you've seen currently in these acts? Like, is there anything you feel is missing or is not being addressed?
I don't know if anything is missing. The thing about all these federal funds that are going to states is states have a lot of discretion on how they're going to use it. And I think that's good because every state is different. They've got different needs. Maybe you want to focus on teachers and wages. Maybe you want to focus on helping parents pay that copay or eliminate copayments. Maybe you want to think about, how you reimburse providers. There's a lot of discretion on how you can do that work, or maybe you want to, create systems for technical assistance and training so that programs can stay afloat. But again, the thing I think I would like to see is not that they have the provisions, but that we do something to keep them going past, the next couple of years. We need sustainable funding, and it's great that these things are happening. Hopefully, this can be these kinds of ideas that are happening across the country can serve as pilots, so that that childcare leaders and policymakers can see that they're powerful and that they are effective, and maybe that will push the needle to continue to fund these things. But I think one of the things that it's not necessarily missing, but we would like to highlight and push out further is you can use ARP dollars and some of the other financing dollars coming from the federal system to work on improving systems, technology and data collection and that kind of thing. We at Child Care Aware of America are really pushing what we're calling interoperable systems. And the reason why we are interested in that is because we know that if you don't have good data on what's happening in childcare, where there are gaps, like we've been saying, and how the dollars that are being fed into systems are being used and how effective they are, it's really hard to make the case to continue this work. It's really hard to say we need to have this because this many children are missing or don't have access to childcare if you don't have the good data. What we would love to see is funding being used at the state level for improved data collection systems so that we can analyze that data and can make the case for this work. We also want to see that states think about how they can improve these systems to have real-time data. So think about when you go to Amazon and you try to buy something and it tells you there's only 3 left. You don't get that in childcare, and if you do, it might be older data. So even we do a lot of mapping and we get data, every month or every couple of weeks. Even that, especially during a crisis time like the pandemic, is not fast enough. You need to have real-time data so that you can be able to tell parents where there are available seats for those infants and toddlers, where there are very rare seats. So we're really would love for states to think about how they can use these dollars to ensure that we have good data systems, because those good data systems will help us understand what's happening and help us direct and target funding to meet the needs of communities.
That's great. And I think it's interesting that you brought up the data systems, because it's very important right now, not only in the retail sectors where you see a bigger push to incorporate more data into decision making, but also in this childcare industry. We looked at the diagram earlier, which depicted how kind of complicated the system work is and how many inputs are involved in that. And I typically agree with you in terms of being able to have a more unified national system, but with the ability for states and regions to kind of direct resources in a manner that which best fits their needs. And so I think that's excellent. Keisha, same question. What types of things would you like to see passed, or which ways would you like the funding to be utilized?
So I would just, echo everything that Dr. Dobbins just indicated. Not necessarily, maybe see anything, added. I think that, many of the pieces, are there, but again, to better, have that information in the data of exactly, um, what's needed, and that's going to look different state to state, from one area, to another. So, some type of, mainstream, of course, just, I could not, indicate it any better than how she just explained it. Because we will, even have, some referrals that may come here through, other agencies, and it's, just being able to better educate, the parents on what's available. And so if there were, were some type of system, in place to clearly, communicate that. I know during the pandemic, we received several, phone calls from our state capital with individuals trying to, collect data. And we may have received a phone call on Monday, only Wednesday to receive that same phone call, in question. So there's a clear indicator that somewhere the, the communication and, the data is not being, achieved like it should be.
And LaKesha, as you said, like you could have gotten a call on Monday during the height of the pandemic. On Monday, that data would have been out of date by Wednesday.
Right.
Things were happening so quickly.
Right.
But if you have real-time data and data where different agencies and different organizations could talk to each other, you could seamlessly provide the information that's needed to parents and providers to ensure that kids are getting served.
Absolutely.
So Dionne, is there anything that is even remotely in place right now that could accomplish this? I know we're getting ready to move into question sections, but is there anything that you know of right now that is in place that will be able to kind of interconnect all of these different avenues between the providers, between the advocates, between the lawmakers, between the the families, and just kind of make this a cohesive system that can operate more like an Amazon, more like, someone that are performing well?
Well, short answer, there's nothing out there now that's doing all of that. However, one of the things that we're working on at Child Care Aware of America, and you can see I linked to our data on interoperability suite that talks a little bit about the importance of why we want to do it this way and how states need to, connect and work together. There's going to be, we're working in a couple of states. We're working in Kansas, and we've done some work in Pennsylvania, and we've done some work in Texas. Texas now, during the pandemic, created a hub where you can go and see more real-time data on where where providers were open and where they were closed, how many slots they had. That funding that, they had funding to do that work. And that's the problem. Like, it's a lot, the technology is not easy, it's not cheap. But really the important part is like really thinking through, like, what would you want to include in a system like that? Who is feeding into that system, and how many people can view it and get data from it to make decisions. So the short answer is we're not there yet, but there are states that are trying to tackle it, and there are opportunities for technical assistance and thought leadership around that through some of the work that we're doing at Child Care Aware of America. I'm happy to connect folks with some of the people who are doing that work and really thinking about how we can do this on a national level. But right now it's a state level kind of where people are tackling it with the money that they have available.
Okay. And that being said, LaKesha, what type of support was available to you when you first started out, as far as being able to get the information that you needed, funding opportunities, where to send your parents if they had questions? What was available to you, and has it changed over the years?
Sure. So I believe that it's been pretty consistent, even with starting out in 2010 as a family home child care provider. Many of the same subsidy programs we still have access to as a center that we did as a home child care provider. They're, on a different scale of sorts, of course, because of the, the difference in the number of families that we're able to serve. So there, I still, believe that there is additional work that can be done from a standpoint of both state as well as, myself as a provider and other resources within the community of just, communicating and educating parents to let them know what is actually available to them for assistance.
Right, got you. And um, do you think better information would encourage more people to become providers of child care, would enter the industry if more people had access to like what it took to open a daycare center, and some of the nuances involved?
So I believe with more information being accessible, then possibly you still would need, to want to make sure that that those individuals, of course, had a desire to really, provide, great quality, high care to children and families. But absolutely, I think, knowledge is definitely, power, and sometimes we may shy away from opportunities just because we may not be clear of what all of the ins and outs are. So I think providing that information and making, it more accessible to more people could definitely be an avenue to open up the industry even more.
Great. And I think you said something very interesting there when you said desire. I know a lot of times when I ride around different areas, whether it's Birmingham or when I was in the military being stationed in Jacksonville, Virginia, Rhode Island, most of the child care centers in the areas seem to be opened and ran by folks local to that area. Talk a little bit to that about your experience, and you possibly opening your child care where you did.
So sure, absolutely. So where we are located here in Birmingham and in what's called the Southeast Lake area of Birmingham, Alabama, is where I grew up. So it's where I spent a lot of my time as a child, and it's still a community where I reside today. So it definitely had a huge impact on the choosing of the location. Not only, as we were doing our research, knowing that the infants were not really being served in the community, but also just wanting to bring about that quality child care to the facility, to the neighborhood. Sorry. One of the other things that I noticed as I did research was some of the providers' education level may have stopped. They were owners. I'll say that, not necessarily the directors, but the owners. They were just owners and not necessarily working in the center as I am right now.
Got you. Understood. And Dionne, you mentioned being able to provide real-time data on the childcare system. In a lot of industries, this comes in the form of point of sale data. But in the childcare industry, this might add additional burden onto the providers. Is there a way for us to address this issue and not necessarily add additional work to providers who might already be stretched thin in their duties?
Yeah, I think the key is figuring out ways to make it so that it's part of their everyday programming, and make sure that it's not something, like you said, burdensome. So for
Right.
instance, there are systems being built to help reduce that burden. We've seen programs where you are a text gets sent to you and it says something like, are you fully enrolled today? It's a yes or no question. Yes, yes. Or how many kids are missing? And it's like 1 or 2, 3 or 4 or whatever. And it's like a very quick multiple choice, maybe 3 questions. We're not asking for like, detailed data, which child is missing, what neighborhood are they from, what language do they speak? No, just very simple, quick and dirty texting programs to get the flavor and the landscape of what's happening in the communities that we're looking at. There are also a number of childcare management systems that are out there that are available to help make this data collection easier and efficient. In fact, they have ways of, like, I've seen where they have parents do electronic check-ins. So it's on their phone. I'm checking in my child. You know that so-and-so made it here today, but 3 other kids didn't make it here today because their parents didn't check them in. So there are ways that we can think about doing this efficiently. And of course, we definitely don't want to increase the burden on providers, but we also want to get providers to understand, and CCRNRs and state level folks, that that the data can be useful to them. And I think that if people understand how data can be useful to them to help them create better quality or better accessibility for children, then they can kind of buy into maybe the little bit of extra burden that you're asking them to do when you're asking them to collect data.
Right, right. That makes a
And
lot of sense. Go
I would
ahead, Keisha.
like to add, that's such a great comment by you, Dr. Dobbins, because here in the state of Alabama, just this week, and it'll be effective in September, that we are able to use our electronic sign-in for the state. Up until now, it was something that was not even acceptable. So that was, just such a breath of fresh air, because in the time even prior to COVID, that was something that we wanted to adopt, was the electronic sign-in, and making that available to our families. And so we were having to do the double lead work of requiring the signature sign in and the electronic sign in, because as verification for enrollment, the state was only going to accept that written signature. So this coming September, they finally updated our standards to where they will accept the electronic code or electronic signature. So I'm so excited about that.
I would say if there's one thing that we may have been a benefit to the pandemic and it happening, is the understanding that we can do things in different ways, and that we can use technology and electronics and data in many different ways, and we don't need to stick with the old-fashioned ways of doing it. And I've heard a lot of examples like that, where like the licensing, we can do it without maybe driving there. We can do virtual licensing, check-in, all kinds of things. So
Yeah, I agree with all of that. Before we close out here, I'd just like to give each of you a chance to just give one final thought to our attendees, and maybe some state representatives who would hear what you have to say. What would you like to tell them about what we're looking forward to, or how this childcare discussion should end, or what it should end with, as far as funding levels and such?
I don't have a number to give. And again, as I mentioned, we are very excited about the dollars and the attention that childcare has received over the past year. It's almost like it took a pandemic and this kind of crisis for this to be elevated. But we know that it's really critical that we not only think about this work and these relief funds, which is what they really are. They're relief funds. They're trying to help us catch up, but we need to have long-term funding. And we do have some advocates, both in our administration now, as well as our congressmen, and at the state level as well. So I encourage you to check out our website. We are keeping people up to date on where the different acts are, and helping you think about how you, as either a provider or an advocate or a parent, can make the case for affordable, quality, and accessible childcare, and giving you talking points, helping you talk to state leaders. So I encourage you to check out our website and go quite frequently, because we're trying to keep it up to date based on what we're hearing and what we're learning from the policymakers.
That's wonderful. And LaKesha?
Sure. I would just add that a continuation of coverage for it to not end here with the American Rescue Plan Act, that it continues just to be an ongoing plan to assist with funding for childcare centers. Myself as a provider, and I'm sure other providers, we desperately need that funding so that we can hire qualified childcare teachers for our facilities, and really be able to pay a wage that families can support themselves off of. That was one of the biggest challenges for me in even being able to transition into the childcare industry, was because of the hourly wage that I knew what would be offered. And that was back in 2006. I was only able to make the transition from corporate America into the childcare industry because I got married. And so I no longer was a one income, individual. But without, being married, I could not see any other way that as a single mom, I would have been able to provide for myself and my child, and to do essentially what I love doing because of the huge wage gap. So definitely the funding is needed to assist with that.
Great. I just would like to thank both LaKesha and Dionne for joining us for such an important discussion right now in our country. This is an issue we've been dealing with for a long time, and we've been attempting to address it, through the block grant in 1990, which was established in 1990. But as we can clearly see, there are still some issues that we need to work through as a country. I think some very good points were brought up today, disaggregating the data for the childcare deserts, and being able to get a more comprehensive look at which age groups are being most affected, by area. Is very important to be able to get a complete understanding of the type of challenges we face, and the type of solutions that we need to face those challenges. So I just want to thank everyone for joining us this afternoon. Again, thank you, LaKesha. Thank you, Dionne, for this wonderful discussion that you've helped us have today.
Thank you for the invite.
Absolutely.